Sometimes the most dangerous health problems don't arrive with dramatic pain or sudden warning. They show up quietly, almost politely, in little changes that seem easy to dismiss. A bit of fatigue. A new ache. A strange feeling you can't quite describe. And for many seniors, these early signals are the body's last gentle whisper before something far more serious develops. Dr. Anthony Fauci often reminds people of one simple truth: the body rarely stays silent before a major issue, we just learn to live with the noise. And today, we're talking about 3 symptoms that older adults should never ignore, not because of fear, but because paying attention can genuinely save your life. The first symptom is unexplained shortness of breath, not the tiredness you feel after climbing stairs, but the sudden kind that makes simple tasks feel heavier than they used to. Many seniors chalk this up to aging, but it can signal problems with the heart, lungs, or circulation. Heart failure, anemia, arrhythmias, or even infections often begin this way. What makes it dangerous is how quietly it creeps in. If you notice your breathing changing, needing more rest, feeling winded while talking, or waking up breathless, your body is signaling strain. Practical steps like pacing activity, staying hydrated, and monitoring salt intake can help in the moment, but what truly matters is timely medical evaluation. Early detection is powerful. It allows treatment before the condition becomes irreversible. The second symptom is unexplained swelling, especially in the legs, ankles, feet, or abdomen. This is one of the most overlooked signs among older adults. Swelling can indicate fluid buildup from weakened heart function, kidney issues, or chronic vein problems. Many seniors ignore it because it doesn't hurt and because compression socks or elevating the legs seem to fix it temporarily. But persistent swelling is your body saying, something isn't moving the way it should. Supporting your circulation with gentle walking, limiting processed foods, and keeping legs elevated can ease discomfort, but swelling that appears suddenly or grows over time needs professional attention. Left unchecked, it can progress into dangerous complications like heart failure or severe electrolyte imbalances. And the third symptom, perhaps the easiest to dismiss, is sudden confusion or noticeable changes in mental clarity. This is more than forgetfulness. It's that feeling of not being fully present, of losing track of conversations, or struggling to follow simple steps that were effortless before. For seniors, sudden mental changes can be a sign of infections like urinary tract infections, medication side effects, dehydration, blood sugar imbalances, or even minor strokes. These conditions often respond extremely well when caught early, yet they are missed because the person appears fine on the outside. Drinking more water, reviewing medications with a provider, and maintaining consistent sleep can support brain health, but confusion that appears suddenly or worsens is always a red flag. The reason these symptoms matter is simple: aging may change the body, but it doesn't erase the need to listen to it. Many seniors minimize these changes because they don't want to worry loved ones or bother their doctor. Yet the sooner these signs are understood, the easier it becomes to protect long-term health and independence. If any of these symptoms resonate with you, the breathlessness, the swelling, the sudden shifts in clarity, take a moment to be gentle with yourself. Notice the patterns. Pay attention to what feels different. These signals are not failures of the body, they are its resilience, trying to communicate in the only language it knows. And as you move forward, let this awareness settle softly into your daily routine. Let it guide you toward better hydration, steadier habits, and small steps that support your heart, lungs, and mind. There is hope woven into every early sign you recognize. Every moment of awareness is an opportunity not to fear your health, but to understand it more deeply. The story doesn't end here. It continues with every breath you pay attention to, every change you honor, every quiet symptom you choose not to ignore. Your body is still speaking. And now, you're learning how to listen. Shortness of breath may seem like a small inconvenience, a moment of heaviness you can just walk off, but inside the body, it reflects something far more meaningful. Every breath you take is a quiet negotiation between your lungs, your heart, and the tiny cells waiting for oxygen to keep you alive. When you begin feeling winded during simple tasks, like talking while walking or standing from a chair, it often means this negotiation is slipping out of balance. The lungs may not be drawing in enough air, the heart may be struggling to push oxygen-rich blood forward, or the blood itself may not be carrying oxygen efficiently. On a cellular level, the body senses this immediately. Low oxygen triggers stress signals, causing the muscles to stiffen, the heartbeat to rise, and the brain to work harder just to keep pace. Imagine a home where the electricity flickers, the lights still work, but you feel the strain behind the walls. That is what mild breathlessness truly is, the body dimming its switches to protect itself. Noticing these moments early, and responding with awareness and medical guidance, gives your cells the support they desperately need before the system becomes overwhelmed. Unexplained swelling may appear gentle on the surface, a puffiness around the ankles, a heaviness in the legs at the end of the day, but within the body, it represents a delicate system struggling to keep its balance. Fluid doesn't gather without reason. Every drop of blood that moves through your veins depends on a precise pressure system created by the heart, supported by the kidneys, and maintained by the tiny valves inside your blood vessels. When the heart begins to weaken or the kidneys fall behind in filtering, that pressure shifts. Instead of staying inside the vessels, fluid quietly escapes into surrounding tissues. On a microscopic level, the cells in those swollen areas are suddenly bathing in extra fluid they cannot use, which slows healing, disrupts oxygen flow, and triggers inflammation. It's similar to a garden after heavy rain. The soil becomes waterlogged, the roots struggle to breathe, and even healthy plants begin to droop under the weight. Swelling, especially when it appears without injury or grows day by day, is your body signaling that its internal rhythm needs support. Noticing it early, elevating the legs, reducing salt, and seeking medical guidance gives your circulatory system the chance to restore balance before deeper complications settle in. Sudden confusion, even if it lasts only a few minutes, is one of the body's most urgent internal signals, a sign that the brain's delicate chemistry has been disrupted. The brain depends on a steady supply of oxygen, glucose, electrolytes, and neurotransmitters to keep thoughts clear and memory stable. When any part of that balance shifts, whether from dehydration, infection, medication interactions, or changes in blood flow, the brain responds almost immediately. Neurons, which fire thousands of signals each second, begin to miscommunicate, like an orchestra losing its rhythm. You might feel foggy, disconnected, or unable to follow a conversation that usually comes easily. On a microscopic level, this confusion is not just aging, it's the brain trying to protect itself. Inflammation increases, electrical signals slow down, and the hippocampus, the center of memory and awareness, struggles to keep everything aligned. Imagine a lighthouse beam flickering in a storm. The structure is still there, still strong, but the light wavers because the power feeding it is unstable. That is what sudden confusion truly represents. Treating it with seriousness, drinking water, reviewing medications, resting, and seeking medical evaluation helps restore that steady beam, allowing the brain to regain clarity before deeper harm takes root. As we close today's conversation, I hope you feel something quietly empowering, not fear, not pressure, but a deeper understanding of how your body speaks to you. These signs we discussed aren't warnings meant to frighten you, they're invitations to care for yourself with a little more kindness and consistency. When you pay attention to your breathing, notice swelling early, or honor those shifts in clarity, you give your body the chance to repair, strengthen, and rebalance itself in ways that truly matter. Healing doesn't demand perfection. It doesn't ask you to change everything overnight. It simply begins with small, steady choices: drinking more water, resting when you need to, moving gently, and seeking support when something feels different. Progress grows quietly, almost invisibly at first, and then one day you realize your steps feel lighter, your mind feels clearer, and your days feel more your own. So start today, not with urgency, but with a calm confidence that every mindful moment moves you forward. If this message helped you feel supported or seen, I'd love for you to subscribe and stay with us. There's more to learn, more to explore, and many more chapters of this journey still unfolding.